It's a shake-up of hospital services which some say will save lives and others believe will put lives at risk. From today, for the first time, people can have their say on plans to reorganise services at hospitals in Huddersfield and Halifax, including major changes to A&E. The Calderdale and Huddersfield Trust serves a population of 452,000 people from its two sites in Huddersfield and Halifax. The local NHS says services are unsustainable and that mortality rates are higher than the average for England. There are difficulties recruiting enough staff to meet national guidelines, especially for A&E. And without change, the Trust is facing an underlying deficit of £27.5 million. They want to move all emergency care to Halifax while keeping routine care in Huddersfield. But campaigners are worried lives could be put at risk with increased travel times.
I was coming down off Home Moss, going quite fast around there, and I lost control on that corner.
10 years ago, Ken Walker was seriously injured in a cycling accident on Home Moss. After crashing into a wall, he was rushed to Huddersfield Royal Infirmary, where he received life-saving care. He says he's deeply concerned about plans to reorganise hospital services that could include his local A&E being moved to Halifax.
It was an awful accident here, and hitting the wall. It was a head injury, and I needed to be taken to a hospital as quickly as possible because, I don't know, I could have died.
Thousands of people have already protested in Huddersfield against the proposals, but today marks the launch of the official public consultation into the plans. Much of the attention has so far focused on A&E, but the proposals in this document go much further and will affect all hospital services on both sites. The two hospitals are 5 miles apart and both currently provide a wide range of services. Under the plans, Calderdale Royal Hospital would become the centre for all emergency care, including A&E, intensive care, emergency surgery and a department dedicated to very sick children. Meanwhile, Huddersfield would become a centre for planned care, like routine surgery, medical day cases and diagnostics, all from a new hospital site. Both hospitals would have an urgent care centre to deal with non-life-threatening injuries.
That report from our health correspondent Jamie Coulson. Well, Jamie has been speaking to Dr Steve Ollerton from the Clinical Commissioning Group in Greater Huddersfield, who's had a central role in developing these proposals. He began by asking him if he thought that people living in Huddersfield have lost out.
I do not believe that my population, which I represent in Huddersfield, has lost out at all. Because yes, they may have to travel that small amount further, but when they get there, they'll be getting a far better hospital service.
Can you honestly put your hand on your heart and tell those people who are concerned about lives being put at risk that they won't be under these changes?
I can honestly say that we would not be doing these proposals if I thought that more people were going to die because of it. We are actually making our hospitals safer, and on balance we will have more people who have an improved outcome, i.e. not dying in these new proposals.